future. We can make it so much better. The future's ours to lose.
Hi, I'm Dr. Cal Heinrich, and I'd like you to know that I thoroughly enjoy providing unsurpassed quality of orthodontic treatment for my patients here at Nevada Orthodontic Care. My orthodontic practice is about two things. It's about honesty and it's about quality of treatment. Now, when I say honesty, what I mean is that I thoroughly evaluate each individual person that comes into my office for a consultation to determine if orthodontics actually is the best treatment option for that particular person. And if orthodontics is appropriate, then I recommend the simplest orthodontic treatment plan possible. I don't make things more complicated than they need to be, and I don't propose treatment plans last longer than they would actually have to last. At the first consultation appointment, I use computer imaging programs to explain the nature of any orthodontic problems that exist and how those problems can be treated using the latest orthodontic techniques and procedures. Many people compliment me and my staff regarding our ability to explain orthodontic problems and solutions using those software programs that we have in the office. I spend time determining what are the treatment goals of that particular patient, and then I inform them of the various things that could be done, using the latest techniques of course, to achieve their goals. If the patient is young, when would be the best time to start treatment for that particular child? I'd like to emphasize that when an adult comes in for a consultation or a child is brought in for a consultation, I am honest with the individuals that come in. And I only recommend orthodontics if orthodontics really is the best treatment option for that particular adult or child. In the case of a child, I only recommend starting the orthodontics if it's the best time to start in that particular child's case. If when they're brought in it is the best time, fine, but if not, what I'll recommend is that we reevaluate that child at a later date. I can honestly say that as I work on each individual patient during the course of the day, that it really is my sincere goal to provide the same high level of orthodontic care for each of those patients as I would for a member of my own family. And I genuinely mean that. I'm an American board certified orthodontist, and I have two goals for my patients. The first goal is to provide the greatest looking smile possible for each individual patient. And by the way, that is so much more than just straight teeth. The second goal is to provide the healthiest bite relationship for each individual patient that hopefully will last them their entire lifetime. To me, orthodontics is so much more than just a means of making a living. I honestly can say I love orthodontics. And I say that because when I come in the office, I see the results of my work unfolding right in front of my eyes and hear favorable comments from patients. Matter of fact, many people have told me it's a service that actually changed their life. So I find orthodontics very rewarding. To me, another great interest and satisfaction regarding orthodontics is teaching orthodontics at the UNLV Orthodontic Residency Program right here in Las Vegas. An orthodontic residency program like that at UNLV is where individuals who have graduated from dental school and who wish to become orthodontic specialists, where those individuals go to receive 3 years of additional training in order to meet the requirements that are determined by the American Dental Association to become true orthodontic specialists. I've always greatly appreciated the wonderful training that I received during my own orthodontic residency program years ago. So it feels great for me to be able to contribute to the education of other orthodontists at this time, having treated approximately 5,000 orthodontic patients and taken hundreds and hundreds of hours of continuing education, and always really trying to stay up to date with the latest procedures and techniques and journal articles and so forth, I'm in a very nice position now to be able to give back to the orthodontic profession by contributing to the education of other folks that are now receiving their training. I really enjoy seeing the residents in training gaining the knowledge and the expertise and skills that they'll need to enable them to go out into various communities and practice the specialty of orthodontics, or perhaps consider sometime in the future, after they gain experience and additional knowledge, to become orthodontic educators on a full-time or part-time basis themselves. Frankly, I find that in preparing the lectures and the clinical demonstrations for the residents in the orthodontic program, that's a great way to ensure that my skills and my knowledge are kept at their highest possible levels. I can honestly say that I'm more excited and more enthused about the specialty of orthodontics than I've ever been. And I say that because we can now provide orthodontic treatment for a greater variety of orthodontic problems that people have, and we can provide treatment that's more comfortable for the patient. And frequently, we can provide treatment that requires less cooperation on the part of the patient in order to achieve favorable results. Now, there have been 3 major advancements that have made all of this possible. The first advancement has been the advancement of the development of new orthodontic materials. Second, there has been the advancement of new techniques and new procedures. And third, there has been the advancement of our new knowledge of what it takes to make a smile not only look good, but what it takes to make a smile look great. I will briefly explain about each advancement. The first advancement is the development of new orthodontic materials. A great example of this is the development of special metals that are now used in the wires that connect all of the teeth in the orthodontic braces. The wires that connect all of the teeth in the orthodontic braces are called arch wires. And the metals now used in these arch wires are very high technology alloys. A point of interest is that many of these alloys were actually developed in the US space program. And now patients all over the world are benefiting from the use of these special alloys in the arch wires. They are much more comfortable for the patient, and they are more efficient and more effective, and they don't have to be changed as frequently. Some of these wires are so gentle that they have no force at all when they are first placed in the mouth, and they only begin to work when they are warmed in the mouth, and then they gently begin to exert a moving force on the teeth. In addition to the improved arch wires that are now used in orthodontics, there's been the development of small springs that can be used instead of rubber bands to change the whole bite relationship of the teeth. And this can be a great advantage for some patients. The second advancement has been the advancement of the development of new techniques and new procedures that we can utilize in helping us treat patients who have extremely difficult orthodontic problems, or people who have problems that we couldn't even treat orthodontically in the past. Now, a perfect example of a new technique or a new procedure that we can utilize in about 20% of our patients who have these extreme problems is the option of placing small holding points into the patient's mouth. And then these holding points act as stabilizers and allow us to move teeth in ways that it was absolutely impossible to move them just a few short years ago. To give you a little background, modern orthodontics is about 130 years old. But it's interesting to note that it's only been within about the last 5, 6, or 7 years around there that we have been able to move teeth in the way that we can now move them and actually influence the positions of jaws in a rather miraculous way. So given that 130-year history, there really has been a quantum leap forward in our ability to deal with orthodontic problems in the last 5, 6, or 7 years. Now let's take a look at a patient who has some extreme orthodontic problems and who could benefit actually from the use of holding points. You notice in this patient's case that they have a tremendous crowding of their teeth. Secondly, you notice also that the upper front teeth are protruding in comparison to the lower front teeth. And also you may notice that the patient is biting on their back teeth, but their front teeth are not touching. That's known as an open bite, and that's quite challenging to treat orthodontically. And lastly, you'd have to be a dentist to realize this, but the upper back teeth are considerably far forward compared to the lower back teeth, and that's known as a class 2 bite, and that also is challenging to treat orthodontically as well. This image shows the results that we were able to attain in the treatment of the patient's case. I think you will agree the results are rather remarkable. And I can assure you that had I not used holding points to aid me in the treatment of this patient's malocclusion, we would not have been able to obtain this much of a quality result for the patient. Now, this next patient also illustrates how holding points can be used to help a patient. This particular patient's concern was that she showed too much gum tissue when she smiled. Now, in the past, what we would have to say to patients like this, well, we can't really help you with that problem. What you'd have to do is you'd have to go to an oral surgeon, you'd have to have an operation, you'd have to have general anesthesia. It probably costs somewhere $20,000, $30,000. You would have to have a section of your upper jaw removed above your teeth, maybe about a 1/4 inch or so in the operating room. They would take that bone out, and then they would wire your jaw up and thereby moving your teeth up, and therefore you wouldn't show as much gum tissue. As you might imagine, in the past, not too many people were interested in having that type of a procedure done. But what I was able to offer to this patient, and we were actually able to complete for this patient, was the use of holding points, in which we were able to move the teeth upward slowly and gently. And we were able to move them upward, and as they came up, the bone and the gum tissue came up with them. And as you can see in this next image, there was a rather amazing result produced for this patient. She was extremely happy, and there was no oral surgeon or operating room involved in the treatment of this patient. In addition to what we've discussed so far, we can now use holding points to move teeth so people can actually avoid bridge work in some cases. And as you can imagine, that can be a tremendous advantage for some patients. Another new development involves the fact that Invisalign can now be used to not only treat simple orthodontic cases, but it can now be used to treat complex and difficult orthodontic cases. Most everyone knows what Invisalign is. It's a series of clear plastic overlays known as aligners that are placed over the teeth one after the other over a period of time so that the teeth are straightened. What is different now is the fact that we can use Invisalign to change the entire bite relationship of the teeth by using holding points and elastics in conjunction with Invisalign. Another new development is the fact that we can now treat patients who show too much gum tissue with Invisalign. And that was not possible in the past. We can use that by using Invisalign again in conjunction with holding points and elastics. And also we can now even use Invisalign to treat teenage patients at this time. And this is an exciting new development. The third and last advancement in the field of orthodontics is regarding knowledge. And that is our knowledge of what it takes to make a smile really look great. Years ago in dentistry, and even among non-dentists, people of all walks of life, basically thought, well, you line up the teeth and you get a great looking smile. But we now know scientifically that that is not true, because we have conducted studies and asked non-dentists mainly to evaluate what are great looking smiles and then determine what are the factors that create a great looking smile as opposed to an average or acceptable smile. Now, there's been a number of studies that have been done, but I'll cite just one of those studies in this presentation as to what are the variables that go in to producing a great looking smile. This particular study involved having 300 people who were not dentists evaluating computer images of smiles to determine what they thought were the characteristics of the best looking smiles. Let's take a look at the amount of gum tissue that is visible in the ideal smile, according to the evaluators. In this image, it shows the ideal as being where there is no gum tissue visible in the ideal smile. Actually, there is a very slight covering of the upper front teeth by the upper lip. In this next image, the evaluators felt that there was beginning to be too much gum tissue showing in the smile when there was 3.5 millimeters of gum tissue showing. That would be the equivalent of 3.5 dimes stacked on top of each other. In this next image, the evaluators began to feel that there was beginning to be too much coverage of the upper front teeth by the upper lip. Let's take a look at something called the smile arc. That is defined as how the upper teeth match up with the outline of the lower lip. I'll repeat that. The smile arc is how the upper teeth match up with the outline of the lower lip. If it's appropriate, it makes for a great smile. Now, in this ideal image, it's shown where the upper front teeth follow the contour of the lower lip, and about half of the back teeth are being covered by the lower lip. In this next image, too much of the upper back teeth are being covered by the lower lip, and the upper front teeth are not following the contour of the lower lip. Let's take a look at the space that is visible at the corners of the mouth. In this image, it shows that a little space at the corners of the mouth was actually considered the ideal by the evaluators. This next image indicates that there is beginning to be too little space at the corners of the mouth. And this next image indicates that there is beginning to be too much space at the corners of the mouth as determined by the evaluators. The next variable was the slant of the upper eye teeth. This shows the ideal, when the upper eye teeth are running straight up and down. This next image shows that the evaluators did not like the slant of the eye teeth to be going outward more than is shown in this image. In this next image, it shows that the evaluators did not like the eye teeth to be slanted inward more than is shown in this image. Another variable was how is the middle of the upper front teeth centered in the face. This image shows the ideal with the middle of the upper front teeth centered directly in the middle of the face. This image indicates that the evaluators did not wish the middle of the upper front teeth to deviate any more than the amount shown, which is 3 millimeters. Another variable was how wide should teeth be compared to how long teeth are. This image shows the ideal width of the upper front teeth to be 73% of the height of the upper front teeth. Now, the orthodontist can work with the family dentist to produce this for the patient. Now, the last variable to be assessed by the evaluators was regarding the slant of the upper dental arch. This image shows the ideal where there is no slant to the upper dental arch. And this image shows that the evaluators started to object when the dental arch slanted more than 4 degrees, as shown here. Well, it sure is great that we have this knowledge of what it takes to make a smile really look great. But what's particularly exciting is the fact that we not only have the knowledge of what it takes to make a smile look great, but we have the technology and the procedures, if we use the latest techniques and procedures, to produce those really great looking smiles for the vast majority of our orthodontic patients. Sometimes when the gum tissue is a little overgrown over individual teeth, we can recontour that overgrown gum tissue with a soft tissue laser. Now, this is just for minor reshaping of the gum contours, but it can be a nice procedure for some patients. In this photograph, it shows that the gum levels are actually drooped down over the teeth of the patient, and this makes the teeth appear rather short. In this next photograph, it shows the improved gum level after the gums have been adjusted by a laser procedure. Now, as you can see, the teeth appear to be longer, and that's because the excess gum tissue has been removed by the laser procedure. Well, I hope that you found this presentation interesting and informative. I think it's safe to say that modern orthodontics really is a pretty exciting field when you realize all the things that can be done these days. And in support of the value of a great-looking smile, there was an interesting study that was published recently in USA Today. And in that study, it indicated that the first thing that a person notices about another person when they're introduced to them is their smile. Now, here's some smiles that my staff and I have been able to help create for some of our patients.